Hey, so I am overdue for a skin cancer check, and I'm blessed because I'm here to see Dr. Sonia Batra. And so I'm actually crossing my fingers. Skin cancer runs in my family, that this is a good news appointment.
So how can I help? What brings you in?
So the biggest thing is my mom had melanoma. She actually had basal cell as well as squamous cell cancer. And I realized it's literally been 4 or 5 years since I was checked.
Okay.
And the last time I was checked, I did have a few suspicious moles removed. Luckily, they were benign. I'm smart enough to know that this is the one thing or the type of thing that could bring someone like myself down. I know I put myself at risk. I biked across the country back when I was in my 20s, and I rode the entire way pretty much without a shirt on.
Do you want to change into a gown? I'm going to put a really bright light on you. And I always start with the scalp just because it's unfortunately a pretty risky area. You have medium to pinkish brown, crisp, well-demarcated moles, which are actually scattered throughout your scalp. Nipple down the lip is another area we always like to check because it's a very high-risk site for skin cancer, because even when people sometimes are good about their sunscreen, they're not wearing a lip balm that protects the lip. And so this one, just because it's a little bit larger than some of your other moles, I'm actually going to take a little closer look at it with the derm light. And I'm going to have you bring your arms up for me for 1 sec. We actually consider moles on the hands and feet sometimes to be slightly higher risk because people don't check and they don't catch them in time. So this one I'm definitely going to take a photo of, and we would just keep that in your chart and compare it and make sure that it remains stable. You do have more moles than the average person on your back, but they are very similar to each other. There's consistency. As you know, skin cancer is the #1 cancer of any type in the United States. So there's a 1 in 5 chance any American will be diagnosed with skin cancer at this point.
I know I'm at risk. Please welcome back to our show dermatologist Dr. Sonia Batra, and thank you for examining me. I wanted to say one thing really quickly, which is these are the kinds of things that can be health scares, but really going to see you, it was the opposite. I left your office and I felt better. And that's just the one thing I wanted to highlight to people is I've been putting this thing off because, again, my mom's had malignant melanoma, basal cell, squamous cell, all the cancers. And walking out of your office, I was like, you know what? I feel really good that I went to do that. So I just want to throw that out there. Thank you for
Good bedside manner. So how did he do?
So fortunately, there were a couple moles, like I said, that I photographed, and we also specifically paid attention to those moles on the foot because the hands and feet are high-risk sites. But he's really well informed. You know, fortunately, because of his mom's experience, he knew what to look for, and everything was a-okay. I didn't see anything that looked problematic. So all healthy and normal.
And no biopsies?
No biopsies.
No biopsies.
So, and that was one of the nice things about using that tool I was using, which is a derm light, which actually has magnification and also a polarized light source, so you can get a really up-close view of the pigment pattern without necessarily needing a biopsy.
What I was wondering is this light a pretty common practice? Because I had a mole that was questionable about a year ago, and she just automatically just removed it and just went to biopsy and everything. It wasn't a light involved. So is this something that most of us should be expecting our dermatologist to use?
I think it really depends on the comfort level of the dermatologist, because you have to know what you're looking at. You have to be able to gauge if it's a normal pigment pattern or not. And then sometimes when something really outright looks problematic or concerning, then you don't necessarily want to muck around with the light. You just really think, okay, we'll sample it.
And we
look
have to
under the microscope.
remember also, and I'm sure you see this and you do this in your practice, skin cancer does not discriminate based on the color of your skin.
Absolutely.
So people of darker skin tones, African American, Indian, different ethnic groups, they have to have skin checks also, especially around the nail bed, the palms, places. And you did something that I loved. I mean, not that I loved seeing Travis's armpits, but when you go for a skin check, you have to look everywhere, right?
Yeah,
the patient has to get naked. Did you get naked, Travis?
Didn't you see his cute paper gown? His paper robe?
Did you see the...
A dermatologist never tells.
But everywhere, you can't leave your clothes on. There you go. You can't leave your... My point is that people need to understand when they go for a skin check, you have to take your clothes off.
You have to put on a gown. And if you're just trying to maneuver and look through small areas, it is possible to miss something,
And the one thing we
definitely.
always say with skin cancer, prevention is always better than treatment.